If you're finding value in our episodes, please pause to give us a rating and leave a review. Your feedback is crucial for helping us connect with more listeners. Thanks for your support. Welcome back.
Thanks. It's good to be here. You did a great show while I was away. I listened in. I was in the Yucatan and fishing. We had a good time.
Nice, man.
It's good to be back. And then I went right to a board meeting on Monday morning in Ohio, and it was incredible. I walked in to the dinner the night before. Everyone was talking about Health Further. So we have a bunch of fans. Yeah, we have a bunch of fans in Columbus. I mean, it wasn't a huge dinner. We were 12 people, and like 7 had listened to your show. They were asking me why I wasn't on it. This was on Monday night. It drops Friday or Saturday. I don't know.
Dude, that's amazing. I love to hear that. Yeah, I think people don't know, like, we don't really know who's listening.
That's right. I was like, oh, wow, good. I'm glad you listened to it.
That's great feedback, man. I'll take that with pride into the weekend. Yeah, look, it was fun to do the show without you, only because now I know I can do the show without you. Like that's the only reason why it was fun. Not because I enjoy doing it without you. I'm glad you're back.
We both are going to be gone once in a while, so we have to be able to get the news out. There was a lot of stuff going on last week. So
for sure, I couldn't miss it, especially like with the Medicaid rule stuff. Like that was just like, no way. We have to cover that. Anyway, look, let's dig in, right?
Got a bunch.
Okay, so to the Fed. This was Fed week. Everybody knew, based on what's been happening with inflation, we were not going to get a Fed rate cut. We knew that.
Yeah.
So.
Yeah, we weren't going to get a cut. You covered it last week. The economy also is slowing down pretty dramatically. It's not a recession, but it was not great. So I think people were watching to see what Chairman Powell would say.
Mm-hmm. Yeah. And so what did he say?
He basically said they're going to wait and see, and he's moved further away from rate cuts.
Mm-hmm.
So, I mean, he didn't really give any clarity other than that. But if last meeting he was 50-50, he's now, further. Maybe it's like 70-20 against doing rate cuts.
Yeah.
But they did slow down their quantitative tightening, which is sort of selling off the assets they have on the balance sheet.
It's the balance sheet, right?
Yeah, and it actually takes cash out of the economy, so it's restrictive. They're slowing that down, which I took as, a good thing they can do that is a little bit more under the radar. It's not the headline news, but at least it's slightly positive.
It's a tool. Yeah. It's one of the tools they have.
Right.
Okay, so, I think the reason why that's important, right, is because it demonstrates what direction they want to go in, even though they can't start cutting rates yet.
Yeah, that's right.
Is that fair?
I think every Fed chairman, including Powell, is very scared of what happened in the late 70s, where like they thought inflation was over and they kind of were a little bit more accommodating, and then it took off like crazy again. So they want to be cautious about that, but they see the economy as struggling, and there's the K-shaped thing we've talked about a bunch, and so they're trying to find ways to make it better for Americans, but they also need to be cautious about inflation.
Yep. All right. We don't want to spend too much time on that. Moving on, Treasury yields. Tell me about this. What's going on?
Yeah, so the Treasury is basically front-running or guessing where the Fed is going to go with rates, and they think that it's not higher for longer, or maybe even they would have to raise rates, which, of course, is in driving the yields up, which is okay for people that want to get yield, but it's bad for every other asset.
Right.
Basically.
Bad for stocks, bad for all things
real
equities,
estate, bad for everything.
Yep.
Yeah.
Yeah, so basically that's it. Like
that's it.
That is a signal that rate cuts are not coming in the near term, and therefore the stock market is sour on that.
Yes.
Yeah. But good for people who have bonds.
Yeah.
Okay. All right. All right, moving on. Why it's hard to get hired despite glowing job reports. By the way, if you can't tell, I'm putting Vic to work because
I didn't do any work. Took a week off. Yeah. So the Wall Street Journal had a story where they interviewed a bunch of job seekers, just trying to get below the statistics, we see these reports of lots of jobs being advertised and unemployment rates are low, and yet I have some friends, people, if you have any friends that are looking for a job, there aren't just jobs everywhere out there. So the Wall Street Journal tried to get below the numbers and talk to some actual both job seekers and recruiters, and they came out with the same thing, that there's a lot of jobs that are posted that they're not going to fill. Right. They're sort of just gathering information or whatever, and they're being very picky. There's many more applicants than needed for a job. So it's a hard job environment out there. We'll get the new jobs report tomorrow, but we don't have it yet. So I don't.
Yeah. So I mean, last year was clearly a year of, as they refer to what Meta and Twitter sort of brought about, a year of efficiency. Right. We're going to focus on the bottom line. We're going to look across all aspects of our business, see where maybe we overhired, especially during the pandemic, cut that back, focus in on our core lines of business, not just cut down on headcount, but probably also cut down on initiatives, right? Focus all of our efforts, not just the people, but R&D dollars, just areas of focus. It does feel like in 2024, that effort has kind of settled. And now we're sort of like, okay, we are where we are. Now we're trying to maybe recover from some of the blowback from that, because anytime you do layoffs, it's not easy internally. There's a lot of culture stuff that has to sort of settle down. There's probably things that have to be worked out with your customer base. It's bad news. You've shut down a particular product line. I think about Google. They shut down their Jamboard product line, and I hadn't invested in it, but I was thinking about it, and I was really glad that I didn't, as an example. So this year, it feels like companies are spending that time and energy now, kind of just resetting themselves under this new reality, and not necessarily being really aggressive in any particular direction, although later on we're going to talk about some AI investment stuff, but just internally focused on resettling, maybe retaining the great talent they have, the ones that especially stuck through that hard layoff time. But that's not necessarily a time where you're going to have a lot of job openings, right? If we're just thinking about the cycle here, it feels like we're probably in for at least a year of a tough job market as companies internally kind of reboot themselves and get their act together.
Yeah, I think that's right. I'd say we had sort of a tactical wave of job reductions and layoffs last year. It wasn't like a bad recession, just cut 30% of everything because we have to do it.
That's right.
It was much more like we need to cut here so we can reorient our business and maybe invest in areas that are growing more.
Right.
And I think that is being digested, as you said. But I don't think there is many companies that are hiring like massive numbers of people. And a lot of people, including me, are trying to figure out, well, what is AI going to be able to do?
Right.
And I play with it all the time, but and I think there are some jobs that it can replace, but it's not clear yet. And so not a lot of companies, I think, are hiring massive numbers of folks. It's just kind of a slow. I don't think there's a lot of job cuts, but I don't think there's many job openings either.
Yeah. And also the other side of that, especially as we think about consumer spending, is you cut jobs. Okay, well, people get a little bit freaked out. Even if they keep their jobs, they spend less because they're saving more because maybe they get laid off next. Well, that saving and that drop in consumer spending leads to missing the projected GDP growth.
Right.
Projected 2.1, 2.2%, end up at 1.6% growth, right? Okay, well, that's not great for so many sectors of the economy. So there's a little bit of cyclicalness to this, right? Which is layoffs are not just, good for the bottom line only. They could potentially be bad for the top line.
Yeah, definitely. And I think it's also true that the Biden administration, but across government really, since the pandemic, there's been a lot of government spending, a lot of the aspects of the economy have been kind of propped up by significant government spending. And I expect that to continue through the election because that's something that every government does. But I don't know if it continues forever. So we may not be able to live on government subsidies forever.
Yeah, well, they're clearly tightening up. I mean, when you look at the rules, they did everything in the in the IRA, but I think the rules we're seeing this year are actually much, much tighter. At least from our lens on healthcare, you think about how that trickles all the way down. It's they're allocating more through margin mandates to labor, but they're not paying at the high level the companies anymore, right? So that's obviously going to ultimately have a trickle down of restriction on the workers.
Right.
So,
yes.
All right. What's the story here in the Wall Street Journal about? You like the Journal today. California fast food chains are now serving sticker shock.
Yeah. So maybe go down a little bit. I think the tagline I liked was a hamburger, which is the cheapest item at McDonald's. It's like $3.50 now.
Hold on, just the baseline hamburger?
Baseline hamburger. Go down a little bit. Yeah.
We're not talking about a Big Mac.
No, this is just the regular burger. I mean, so, you see $16 for a meal at Chick-fil-A. That's just like the spicy chicken sandwich at Chick-fil-A. And a little bit further down, I think, is the McDonald's one. So here, McDonald's hamburgers $2.50 each. Big Mac is $5.40.
You know what? So the last time I ate at McDonald's regularly, I remember the hamburger was on the dollar menu.
Yeah. Like
that was the whole
hamburger
point.
And cheeseburger were on the dollar menu because it was. I was always surprised that there's no extra cost for the cheese because who cares? But, but yeah, it's $2.50 now.
Wow. That's
and so again, I keep coming back to it, but this K-shaped thing, there's a lot of pressure on people that, some people just love McDonald's and fast food, but a lot of people are getting their calories there because it's cheap.
Yeah, that's right.
And the prices are going up significantly. Now, it's worse in California than the rest of the country because they also instituted the minimum wage.
They forced the fast food worker minimum wage to go up.
Yeah, exactly.
Yeah, look, I feel
it's just inflation. Inflation is...
It's not just inflation. I feel like a regular theme when we talk about policy and when policy seeks to mandate things on business, it's like I don't understand why they don't ever price in how that is going to change the way that the business acts. Like the business is never going to take it on the chin without responding to get their P&L back to where they want it to be. Never.
Yes.
That's just not how this works, So I think it's just such an interesting thing that we regularly cover the ways that policymakers try to mandate P&L things.
And it has often it has unintended bad consequences like this. Probably the workers at these restaurants a lot of times buy food from similar restaurants.
Of course. And then, what might be another thing that they might do? They might take away, some level of perks that they have, right? I mean, you're focused totally on the wages. You didn't focus on the benefits. You didn't focus on the perks. Okay, fine. Well, I'll just balance it out that way. So anyway, I mean, I'm not saying that these different policy initiatives are not well-intended. They just seem to not fully understand how to properly incentivize the private market in America to actually pay workers more, right? That they seem to be very stick-oriented, and I don't know what the answer is that's carrot-oriented,
right.
But all I'm really saying is you're not thinking this all the way through because the business is going to adjust and the worker and the consumer will get screwed.
Yeah, I'm more cynical than even that. I think the politicians stop listening after the headline. Yay, we got fast food workers a higher minimum wage. Let's celebrate. And then they move on to the next thing. And they don't know that this unintended consequence is going to happen, but I don't think they really care. They're moving on to a new topic.
That is certainly cynical.
Yes.
All right. More in the Wall Street Journal. Office loan defaults near historic levels with billions on the line. Okay, so are we nearing kind of this story that we talked a lot about probably 20 episodes ago?
Yeah.
We kind of gave it a break because we were like, we're going to wait until it happens.
We all got tired of hearing about this pending thing. But 38 billion that are facing loan defaults, I think is a significant. Everyone knows the real estate, office real estate in kind of the big cities is a challenge. So I'm sort of following it at a low level, but it's going to have to get refinanced at some point.
Yeah. Yeah. So, okay. So in the picture in this story, it's showing the Aon Center in Los Angeles. It says it was recently sold at a huge discount from its price a decade earlier. When I was in Chicago, actually I was in a suburb of Chicago, for an HFMA board meeting probably a year ago now. They were pointing out some buildings that were currently on the market, about to basically be like sold at a fire sale, you know?
Yeah.
So I think the thing is, this is kind of quietly happening. No one's necessarily paying attention to it, but the keys are changing hands in some pretty big recaps of these buildings. And, you know, maybe that's what happens, right? Maybe there's just, I think we covered, there was sort of some Japanese funds that were sort of
New York. They bought a New York asset.
Right, exactly. Yeah. So maybe what ends up happening here is not so much kind of like a massive sky is falling fallout kind of thing, but maybe it's just a transfer of wealth. Maybe it's just a bunch of folks, you know, are caught with their pants down because they got caught in the middle of the, you know, the rate hike, and there's new capital that's going to come in. It's going to, you know, take on the liability, but it's going to reprice everything, and they're just going to buy it at a much lower discount. People are going to be willing to get out of the asset at the discount, you know, kind of take their losses and go home. And maybe that's how this all plays out. You know, not like
that's the best of all possible scenarios.
Yeah.
That's what the market should do.
Well, there's a lot of capital sitting on the sidelines right now. So I mean, that might be what ends up happening here. And then these people who are buying these buildings, they have the job of trying to figure out, okay, well, now what are we going to do with them, right? Because they're not going to be office. That's not going to happen. So maybe you turn them into a bunch of residential. I mean, we need a lot more affordable housing in these city centers. So, you know, if you can retrofit a lot of these buildings to be dwellings for people at lower, you know, at affordable cost, it's probably a good thing.
Yeah, that would be great. I think a lot of the layout and architecture is challenging to move to residential.
It may be challenging, but
they'll have to figure it out.
Yeah, it may be challenging, but I bet, you know, maybe it's challenging from a current you know, zoning best practices perspective, and, you know, cities that need affordable housing solutions will probably have to evolve and adapt and, you know, leverage some new technologies to figure out how to support people who want to buy these buildings, you know, because these are also sort of problems for the cities, right? I mean, you can't just have abandoned, unmanaged buildings in your city. That's not that's not a thing. You can't have that. So you need someone who's actually going to take on the building, who's going to support the building. It's certainly a win if you can fill it with people and house people.
Yeah.
So
I mean, that works well. The problem comes if so the equity investors will lose their money. Yeah, but if it goes below the debt, that is difficult on the banks. Right. So that's what we're watching for.
Yep. All right. Continuing on. All right. AI startup CoreWeave nearly triples valuation to $19 billion in 5 months. Okay, so the only reason why I won't totally think this is a joke is because NVIDIA backed it. However, we've already seen NVIDIA-backed companies lose their founder and CEO to Microsoft. So, I mean, just because NVIDIA is,
in my opinion, backing a lot of AI startups because
they got the balance sheet to do it.
Right.
The market's paying them to do whatever they want right now.
Yeah, so CoreWeave sort of rents out either racks or parts of racks to companies to help them use AI. So you're
talking about data center racks?
Yeah, data center racks. So it works pretty closely with NVIDIA, I think. But $19 billion and growing, was it 5x or 6x or something in 5 months is crazy.
Yeah, I mean, that's crazy. So Coatue led the $1.1 billion funding round, and Lord knows Coatue needs a win.
Yeah, but may not be the best way to get a win to chase a huge valuation. But that's maybe.
Well, but they've grown 5x in 5 months. Is that what you just said?
The valuation has grown 5x.
No, the valuation grew 3x.
Triples in 5 months.
Yeah, the valuation tripled. What about the actual business? Have they reported about how the business has actually grown, or is this just all hype cycle?
It's all hype cycle.
Okay, yeah. So the only thing to say here is that there is, you know, mark these words, there is irrational exuberance in 2024 in the AI space when it comes to funding. And by the way, the growth equity funds, they got to place their capital someplace, and they got to write big checks, and they're not going to get in trouble for backing an NVIDIA-backed company that's integrated and has a strategic partnership, right? Probably just back up the truck to that one and then, hope it actually plays out. It's at least an allocation strategy. This is why I would not want to be in growth.
Right.
In growth capital right now.
I agree completely. That's why I'm not either.
You have to write ridiculously large checks.
And you got to get access to deals that everyone else knows too.
Yeah, and it's like, is CoreWeave going to go public?
I don't see how they can go public.
Does that business model sound like a solid publicly traded company?
No.
Okay, that. Let's start there. That does not sound like a publicly traded company to me. Renting out rack space.
They don't own the data center.
That's what I'm saying.
So they have a piece of the data center. Yeah, it's asset light, which is okay, but
it's okay P&L. It's also not defensible.
It's not defensible.
Yeah, it's not defensible. It's great for venture, especially if you're trying to ratchet up your margins and grow very, very quickly, focus all on sales and marketing, but that's not defensible, man.
Yeah.
And also if you're asset light in that kind of business model, you can be strategically boxed out.
Yeah.
That's another thing, right? Okay. Moving on. Baton Health launches platform to streamline provider credentialing they cut verification time by okay.
By 100%. There is no time anymore.
They cut verification time by 99.9%. Yeah. Dude. Oh, God. Do people even think about how things like that sound? Well, just like how it sounds when you say stuff like that. Like even if it's true, what you're really saying is you've totally eliminated something. Just say that you've eliminated something. Like cutting the verification time by 99.9%. Just anyway, this is a redesigned health company, and yeah, look, you and I talked a little bit about it. So they raised $8.75 million in seed funding. They've partnered with Amwell, Mockingbird, the Clinic by Cleveland Clinic, and Brevard Health Alliance of FQHC in Florida. So basically a C-stage company. That's a client list of a C-stage company.
Right. And credentialing is a hassle.
Yeah, but dude, as you and I both know, we know probably the company that's just crushing this space that nobody knows about. Yes. And they've been in the space for a decade now, and I'm not competing against them. So
yeah,
that's all I got to say about that. I think people think that nobody's actually tackling credentialing, but that's not true. There are companies out there doing a hell of a job at credentialing. Now, I guess the one thing I would say, though, is looking at this client list, there's no hospitals here, right? So it's not Cleveland Clinic, it's the Clinic by Cleveland Clinic. And I'm assuming that's like their, either virtual care or urgent care model. They've got an FQHC, they've got Amwell, which is telehealth. So maybe what they're doing is they're going to these ancillary, provider-based organizations that are not hospitals, and maybe they're just, tackling a different market segment with very similar technology, which is a model that can work.
Yeah, starting off in a beachhead part of the market and then growing into the overall market is a very common thing a lot of startups do. And I think credentialing, as you said, we know one big company, and I know a couple other small ones that are already doing this.
Yeah. But
it's very core to the identity of the hospital, and they have a lot of liability if they mess it up. So
that's right.
Several years ago, I tried to replace this at a big for-profit hospital, and they just didn't care. They're like, yes, we have 4 floors of people doing stuff, but they haven't made any mistakes. We haven't gotten in trouble, and why it's not broken. Why we want to fix it?
Right.
So I don't know. I think it's a kind of they're attacking a small-ish, small side of the space. And it's a hard thing to displace.
I feel like this is one of those spaces that, either you've worked in it and you know how hard it is, and so you go off and you create the company that maybe what the founders are, or it's one of those aspects of healthcare that if you haven't spent a lot of time here, you look at it and you go, oh my God, like
it should be easy to replace.
This is like, and just not kind of understanding all the psychology issues that are going on.
I lost money in 2017 with that.
All right, good. We're moving on to payers. So Wall Street Journal, CVS made a big bet on Medicare. It's looking risky.
Yeah, so last open enrollment, so every around November, December timeframe, there's enrollment for Medicare Advantage. And CVS made the decision to be very liberal on their approach to how they would classify kind of extra things that are sort of for sports and fitness and health. So golf clubs, fishing rods, pickleball paddles, they were giving to seniors or reimbursing them as a way to attract, hopefully, healthy, inexpensive, very active seniors. I think that was the idea.
Okay.
And they did attract a whole bunch of new enrollees. They grew quickly.
Free stuff.
But that was the right before 2024 where all the rates have been really challenging.
Oh, okay. Got it.
And so they sort of piled in a bunch of new enrollees as they were getting less profitable.
Got it.
So, maybe it is going to be, if they keep them for several years and it might plan out, but the early kind of returns are they ramped up, just before it became not that profitable.
That's just a bad timing thing, right? I don't know. The CVS folks are pretty good operators. I expect they'll navigate that.
Yeah, they I think they missed earnings or they were commenting
lower
on
than
this.
expected.
They lower than they planned on.
Yeah,
right.
Lower than they planned on. Okay, it's something to watch, but I don't know.
Medicare Advantage had it's a lot of money flowing through it, but you're going to have to manage it really well. Yeah, I think that's the takeaway from Emily a couple weeks ago, from my point of view.
Yeah, I mean, you're going to have to manage it really well. You're also going to have to change your customer acquisition costs and your premium model, right? Yeah. I mean, there's two ways to handle this, right? Focus really hard on like the outcomes and your star ratings and all that kind of stuff, or just like change your premiums and your customer acquisition cost, right? So giving away free stuff, probably at the same time as your margins were being compressed. That's probably just bad math, right? You know, and they probably will change that model going forward as they learn how to improve the margins on the seniors they've already attracted.
Yeah.
I think
that's right.
All right, what's next in the payer universe?
So then Cigna also came out with earnings this week, and as you'll recall, they sold off their Medicare business. Yep. So they have mostly employers now, and they beat earnings. They beat estimates, performed well, and so you're seeing now kind of just a different strategy playing out where Cigna has focused on employers. At least for right now, that looks pretty smart.
Yeah, look, it streamlines their business. It takes them, much more outside of the crosshairs of all the crazy stuff that, CMS is going to throw at them.
Yeah.
Right? And allows them to just sort of navigate with employers who they bark a lot, right? But they don't really do that much changing.
Yeah.
You know what I mean? So I think Cigna's, going to be one to watch, I got to say, because I think that offloading Medicare strategy after the whole Cigna Humana merger, fell apart, actually going in the other direction, selling off, the Medicare business and streamlining, I think it's going to prove to really deliver some great results stock-wise for the rest of the year. So, and I think probably for the foreseeable future, because as we can see, these administrations are using Medicare and Medicaid rulemaking as a political football. Yeah. There's no question about it. They are doing that. And I don't know, as a business, it's tough to be on the receiving end of that, don't you think?
Yeah, definitely.
Another story about Cigna, this is from ProPublica. This is, a little bit of a expose kind of hit piece thing. But talking about how a doctor at Cigna said that her bosses pressured her to review patients' cases too quickly, and that she claims that Cigna threatened to fire her. Yeah.
I don't think it's surprising at all that a payer is employing docs to try to look for ways to deny claims with reasonable medical kind of evidence. She worked there for 15, 20 years. But she now is coming out and saying how much pressure she got to deny. And I'm sure she got pressure to deny. I just don't think it's that surprising. I think a lot of the payers are fighting with providers a lot about, kind of pre-approval things or, should they have done that or not?
I think probably there's two things about this story that were interesting to me. One being that the doctor said that her bosses were pressuring her to review cases too quickly, as opposed to being correct. So efficiency over accuracy, right? I think that's a little bit of a, and look, publicly traded company, quarterly earnings, right? It's like, what are the incentives here, right? What are the incentives? Incentives drive behavior. So that one kind of makes sense and smells like it was likely something that was going on the inside, right? But the second thing, which is, this is just my my naivete and my ignorance because I didn't work in the healthcare industry. The fact that there is a doctor on the other side of that claims evaluation that is determining it. And, of course, there is some of that going on, but that's not how I've ever visualized it when I've had a claim denied. Like when I've had a claim denied, I always just think about there's some algorithm there, right? I haven't thought, oh, there's a doctor on the other side that is sort of in a medical evaluation based on the facts, jousting with my doctor's evaluation. I just had never put those two things together.
Yeah, they have to do that because otherwise the payer loses.
Well, no, it's an obvious thing. I'm just saying.
Yeah, you didn't realize that.
I just don't think the average person thinks about it that way. I think they just think insurance companies, suit, actuaries, blah, blah, blah. Not that there's a doctor on the other side working for the insurance company, reviewing the claim and saying, now, look, all my healthcare friends who are listening will be like, Marcus, you're like so stupid. You didn't know that.
No, I mean,
but I'm just saying for me, that was like, it's like actually kind of illuminating.
Yeah, and I think at one level, it's the way our American system is set up, right? Like we have our judicial system, we have our medical system, we have payers and providers. Right. They should have experts counterbalance each other. That is how it's designed, I think. But it also relies on humans like really trying to do what's best for the patient. And as you said, the financial incentives at these big public companies are significant.
Yeah.
And so I think that's the story ProPublica is breaking. And I can't say if that's surprising.
All right. This is a big one. Wall Street Journal headline: Biden administration aims to reclassify marijuana as less dangerous drug. Man, there's so many implications. There's no way we can cover them all in this show. In the future, it would be great to, bring some experts who can talk about the projected impact to the healthcare system based on what we've seen just in the last 10 years of decriminalization of marijuana use, and what that is introducing to addiction, behavioral health, physical health, et cetera, et cetera. Like I'd love to sort of get a better understanding of how the decriminalization has increased burden on the healthcare system, because I hear rumblings of that, but I don't have any, I don't have any real good base of knowledge of that. So we should seek to bring a guest on the show pretty soon to cover that. But I think the financial implications of this, as well as the criminal justice implications, are really significant.
Yeah, there's no question. So the states have legalized marijuana, several states.
Several states, 20, not all the states.
20, 25, something like that. And there's businesses, because of that, there's businesses operating in those states. But the way that marijuana is classified as a class 2 narcotic, it's being moved to class 3, which means you can get a prescription for it.
I mean, so just so we're sort of not just using jargon. So class 2 is like LSD, like hard drugs. Yeah, right? Heroin is in class 2.
Anything that is illegal, heroin, cocaine. All those are all class 2 drugs.
Right. And class 3 is like Tylenol, right?
Tylenol is over the counter.
Okay.
I think there's a prescription.
Oh, so Sudafed? Is Sudafed class 3?
Sudafed, if it's prescribed.
Prescribed, yeah.
I think class 3 is prescribed.
Okay, got it.
So you need a prescription for Xanax. And so it's a class 3.
Okay.
And so it's moving to class 3. But there's a federal tax called 280 that has been really making it difficult to be profitable as a marijuana manufacturer, grower, I guess, or retailer, because I don't understand how the tax works, but class 2 drugs have really negative tax consequences because the IRS doesn't expect you to be selling them.
Mm-hmm.
And so this will, I think, immediately make all those businesses much more profitable with like the stroke of the pen as soon as it gets kind of maybe it is approved already, which it gets put in place.
Yeah, and so I think that there are 2 downstream potential impacts from there, right? So there's a banking bill that's currently, basically has been held up by this, right? As long as marijuana was a Schedule 2 drug,
can't go across state lines.
Can't go across state lines, so banks can't touch it.
Right.
But I think as it moves to Schedule 3, it's not an immediate trigger, but it kind of makes way for a banking bill that will make marijuana businesses bankable, right?
That's right.
And those are kind of the 2 big things, right? Well, maybe there are 3
There's
big things.
There's a third because we've got to get to criminal justice.
I was about to say there are 3, which is the criminal justice issue. But if we talk about what has held back the cannabis industry, one, it's the margins are bad because of the tax issue.
Yeah,
plus
it's a competitive market. It's very hard. It's like selling anything in retail. It's a tight space, and then they have this bad tax thing.
Yeah, and you don't have good infrastructure because you're not bankable.
Right,
you can't run on usual payment rails. There's all these things that won't touch you, right? Then the second thing is the banking thing because you can't move money. People are like literally just using ATMs to handle purchases, and you can't put your money anywhere. So you're walking around with garbage bags full of cash. Like that's
literally putting like bags of cash in a
bags
U-Haul.
of cash in a bag in a car or U-Haul, right? But then the third thing is the criminal justice thing, which is like, you cross state lines, or you do anything outside of a state that has totally made it allowable, and you're going to jail.
Yeah, right. And I think that's the argument for this change. And to Biden's credit, he what do they call it? He like shortened the sentence to time served for like 200 or 300 people at the end of the year who had marijuana charges because they lived in the wrong state.
Right. Right.
So yes, there's a lot of lower income people that end up in jail because they have marijuana in one of the 25 states where it's not legal. And I think as a society, we have collectively decided that that's not really worth sending someone in jail because it changes the whole trajectory of their life. And then they're doing all kinds of not good things for society and not good for them.
Yep.
So I think that's a very positive thing. The other side of it is, there's a lot of rumors. Part of this is this will allow it to be studied by federal labs.
Right.
And I'm interested in that because there's a lot of rumors, but they're not studied because no lab will study it.
Yeah.
That the marijuana product is a lot more strong and it's affecting teenagers especially. So there's like behavioral health issues.
Right, right.
But it's sort of hard to unpack that from the pandemic behavioral health issues because it all kind of came around the same time. So I'm excited about the research side of this. It's going to take maybe a year, take a little while to get a study up and going, but there's a lot of rumors that I have no frame of reference if they're true or not. But I haven't done this stuff, but like there's things called dabs that are like 300 times stronger than a normal joint or whatever.
Yeah.
I don't know if it's true or not, but it seems like some study would be good.
This is huge.
Yeah, it's going to be great. I feel like it's already legal in half the states. If you want to buy marijuana, it's not hard to find it.
Yeah, and then in the rest of the states, there's like a hybrid of it, right? You got synthetic, you got the Delta 8 or Delta 9 or whatever.
Right.
So yes, it's at this point, it's probably time for the federal government to create some clarity and a uniform pathway for us to advance on this business because we're already doing it. We're just doing it in a really like janky, clunky way.
Yeah, the only people that can't get marijuana are the federal labs that should study it.
Yeah. Good point. So anyway, this is definitely a story to continue to watch from a variety of different levels. And I want to start trying to find some guests.
Yeah, we'll try to find a guest. If anyone's listening that knows a guest, let us know.
Yeah. Okay. Maybe let's stop here and let's let Doug share a little bit about Jumpstart Foundry. Then we'll come back and we'll get back on our Ozempic thing.
Thanks, guys, for the opportunity to talk about our pre-seed fund, Jumpstart Foundry. My name is Doug Edwards, CEO of Jumpstart Health Investors, the parent company of Jumpstart Foundry. We're so excited to be able to talk about early stage venture investing, certainly the need for us to change the crazy world of healthcare in the United States. We are spending 20% of our GDP, north of $4 trillion a year on healthcare with suboptimal outcomes. Jumpstart Foundry exists to help us find and identify and invest in innovative companies that are going to make a difference in healthcare in our country. Every year, Jumpstart Foundry invests a fund, raises a fund, and deploys that across 30, 40, 50 assets every year, allowing ease of access for our limited partners to invest to help us make something better in healthcare. Some of the benefits of Jumpstart Foundry is there's no management fees. We deploy all the capital that's raised every year in the fund. We find the best and brightest, typically around single-digit percentage of companies that apply for funding from Jumpstart, and we invest in the most incredible, robust, innovative solutions and founders in the United States. Over the last 9 years, Jumpstart Foundry has invested in nearly 200 early-stage, pre-seed stage companies in the country. Through those most innovative solutions that Jumpstart Foundry invests in, we also provide great returns and a great experience for our limited partners. We partner with AngelList to administer the fund, making that ease of access not only with low minimums, but the ease of investing in venture much better. We all know that healthcare is broken. Everyone deserves better. Come alongside us with Jumpstart Foundry, invest in making the future of healthcare better, and make something better in healthcare. Thank you, guys. Now back to the show.
All right. So the FTC, every week.
Every week. Lena is in the news.
Dude, not only is she in the news all the time, you know, she's on TV a lot now.
Yeah.
Have you noticed that? Like
she's
if you watch cable news.
She's in she pictures out there. She's got a PR person. I don't know what her plans are.
Man.
Yeah.
She is working it in this election year. So anyway, FTC targets junk patent listings on Ozempic and other drugs. So this is that whole Orange Book thing that we probably covered.
We talked about it maybe a couple months ago.
Yeah. So say a little bit.
They are attacking Ozempic for what is a pretty common practice of extending the patent life by making adjustments to the device and the way the device works with the pharmaceutical and how it all works for the consumer. I venture to say every product company that does devices that mix and also deliver a pharmaceutical, they're all trying to make their device better, and in doing so, they extend the life. And FTC is now really cracking down, is the word that the Journal used on it, to really dig into this and make sure that's not a frivolous, unimportant thing, like they changed the color or they put 5 threads of the screwing aspect versus 4.
Right.
And so I think it's probably healthy that they look into it. If it is frivolous, they should stop it. But at the same time, if they make a meaningful change, that should be in the Orange Book. So
this to me feels like one of the first areas that the FTC is focused on that we've covered in months, where I'm like, actually, this feels like an anti-competitive issue, you know, where at least you need to dig into it, right? You at least need to dig in and kind of see, hey, you know, are people who are leveraging, it's not quite a loophole, but are people who are leveraging this Orange Book, you know, pathway, are they doing it the right way, or are they just kind of making up some shit so that they can, you know, hold on to their patent for longer, right?
Yeah. I mean, I think good for the overall society. We want to protect IP rights for, say, 20 years.
Yep.
And that encourages people to invent something new.
Yes.
And then if they make a meaningful change to that, they should get an extension. But it shouldn't be just an automatic, you say anything is new and just automatically gets put in the book.
Yeah, exactly. All right. Oh, boy. This is another big one.
Yeah.
Man.
I'm worried about even covering this, but we have to just like fight through it.
Oh, no. We know we have to cover this. So
yeah, we have to cover it because it's a healthcare issue. But
so Florida, they have now passed their 6-week abortion ban. It's now law. And interestingly, they were behind the rest of the South in getting this across the line. But I think that's why this is such a big deal. You might look at the headline, and obviously, Ron DeSantis is a very polarizing figure. There's no question about that. He wants to be. He's designed himself to sort of be a very clearly polarizing figure. But it's not so much the abortion ban, although I think many people will think this is terrible.
6 weeks is tough.
Dude, it's tough, and also my whole problem with all of this is it does not it does not recognize the myriad of healthcare issues and the danger to the woman's life that you introduce when you put these wholesale bans with very little, caveats or very little exemptions. It's just kind of very down the middle, and it's clearly based on ideology and theology. It's not based on medical information that sort of says, hey, these are scenarios in which a woman's life is on the line. So that's why, to me, that's not political. That's just like, this is bullshit. These lawmakers should be more thoughtful about this kind of stuff. And that's my opinion. That's my opinion.
Yeah, I mean, I think there's a lot of women that don't know they're pregnant at 6 weeks.
Yeah.
I mean, just by definition, 4 weeks would be like kind of the fastest you could know. And so, I don't know, it just seems very...
Cruel?
Yeah, seems cruel and unlikely to be possible for a woman who is trying to follow the rules to actually be able to...
I would say it's a cruel rule. So anyway, that notwithstanding...
It's law.
It's law now. It's law. And so...
the Times did a pretty good, and so if people are listening in audio, first of all, you should check out our YouTube podcast. We have some new graphics, and it's really good. And this segment will be better. On YouTube.
Yeah, so the headline, and also the links are all in the show notes, so you can always see it there. But the headline of this secondary story is Florida's abortion ban will reach well beyond Florida. And it basically shows that since, the Roe v. Wade was overturned, in 2021, abortion was legal in every state. The average American woman lived less than 25 miles from a clinic. So, it's pretty easy to get access to an abortion.
Yeah, it's 3 years ago. It's crazy.
Yeah. Then the Supreme Court overturned Roe v. Wade. And huge swaths, almost immediately, swaths of the South. We're talking Texas, Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Georgia.
They all had bills.
It was ready to go.
Laws passed that were like triggered when Roe v. Wade. Yeah,
exactly. Florida, North Carolina, and Virginia were the only states in the South that were offering abortions after 6 weeks of pregnancy. So those were the outliers. And now that Florida is closed out. This graphic, as I'm scrolling through, it kind of shows you now that Florida is closed out, basically all that is left is Virginia and North Carolina, which, as anyone who knows, you're basically at the Mason-Dixon line now.
Yeah,
so the South is effectively closed out for business when it comes to getting an abortion.
Yeah, and if you live in Tampa or Jacksonville or even North Florida, it's a long drive. It's 500, 700 miles to go get an abortion in North Carolina. So there's an income level there that like not everyone can do that.
And look, I have to say, one of the things that is so mind-bending about this particular era that we live in right now, and I really mean like post-pandemic era, right? Because this is a different era, this post-pandemic era, is that it seems very clear to me, after living in Nashville for almost 24 years now, but being born and raised in Brooklyn, New York, that the Southeast United States is becoming the new economic engine of the United States. Like, relative to every other segment of this country, the one that is growing more than any other one in economic power, in population growth, in corporate relocations. We just had Oracle say they're moving their world headquarters here to Nashville. It's clearly the Southeast. You don't hear these kinds of stories happening in coastal cities, not in the Midwest. It's like, it's the Southeast. That's where it's all happening. Like, this is where the economic growth is happening. And at the same time, you've got these sweeping, state legislatures and government regimes that are putting these laws into effect that I think are very unfriendly to many of the headquarters that are relocating here. And so it feels to me like people are moving here for a couple of reasons. One, There's more real estate development opportunities to kind of build things the way you want them. These are very business-friendly states. They're very low tax.
I mean, the fiscal policy,
the fiscal part of it, and the business friendliness.
And I mean, just take Texas, Tennessee, and Florida.
Right.
No state taxes. Very low taxes in general, and business friendly.
Very business friendly.
And so I like that. But then and it's Republican mostly. But then the Republicans also pull in these crazy social religious things that, I mean, I'm not very religious, but I don't know why you have to mix that in with my state government.
Dude, like I just feel like the GOP could run away with it right now if they would just quit it with this shit. It's like on the economic side of things, and look, I'm not going to tell anybody what I'm registered as, but like I basically feel like I have no home. Like at this moment,
have no home either.
I don't feel like I have a great home. Okay, but if you're listening to this show and you've been listening, I think Vic and I are free market capitalists, right? Like we invest capital, we like capital, we're both entrepreneurs, we like business.
If I make money, I don't want to pay a lot of taxes.
Exactly, right. all that kind of stuff, right? But like, we don't like telling women what to do with their bodies. Right. Like, this is not like.
I mean, I think the challenge with our two-party system is that I am fiscally conservative, around like spending money, taxes.
And when you say fiscally conservative, you mean from a state perspective. You mean taxes but I mean even for yourself, like
for my personal family or for the city of Nashville or the state of Tennessee or the U.S.
Yeah.
I want to keep taxes low, and I don't want my government spending much money, and I want them to get themselves organized and fix the streets.
Yeah, but you want them to charge enough money in taxes to fix the streets and to protect you, right?
Yes, okay. But I want them to do that effectively.
Yeah, and
so I think Tennessee, just to say what I know best, does that pretty well.
Pretty well, yeah. I mean, there's issues here and there, but I think generally speaking,
like, when I say fiscally conservative, I don't want the state creating wealth for me. I want them to sort of set the playing field, follow the rules, kind of be the referee, and then allow business people to grow and prosper,
and communities to support their own, and neighborhoods to be healthy, and nonprofits to be in place.
And then when you go to the social issues. Okay, I'm liberal.
Stay out of my bedroom.
I'm liberal. But I don't want you in my bedroom. I don't want to go in your bedroom. Right. I don't care who you love.
Right. Right.
It doesn't matter to me.
Yes.
And I think that's a lot of the country.
And stay out of my doctor's office.
Yes.
Like if it's me and my doctor and we're having conversations about me, you stay out of there.
Right. And we have the Republicans that are fiscally conservative, but socially they are also conservative in a way that's hard. And then the Democrats, I mean, I grew up in Boston, so similar to New York, but not the same. But the taxes up there are crazy, and they spend so much money, and it's not, the roads aren't better.
And they can't justify it.
They can't justify it.
Yeah. I mean, a lot of it is to upkeep existing systems. It's not to create new things. I mean, I think that's one of the best things about the South is it's being developed now in 2024, right? I mean, these big, you go to like New York, you're in the middle of the city, and you look up and in Manhattan, it's unbelievable. It's so crazy how many buildings are in New York City, right? It's a marvel that humans were able to create enough cooperation and economic security to build New York City. It's unbelievable. But now you got to maintain it.
Yeah, it's old.
You know what I mean? It's old.
Right.
It's not, New York's not that new. And that's the difference of like a Nashville or like an Austin or like a, these are new cities effectively from a building perspective. And that creates a lot of excitement. It creates a lot of economic excitement, But man, it is so much in conflict with the circus that is, the state legislatures across these different states, with these silly laws and bills. Anyway, I feel like we went on a diatribe doing the thing we said we weren't going to do, but I think this is the truth. Like, it's just...
it's the problem with our two-party system. Where, like, I don't like either party because they both have half of what I want. So I'm never happy. And I don't know. But anyway, it's going to be hard for people in Florida that need to get an abortion.
Well, now across the entire South, because this is the point of this New York Times article is that at least people in Georgia or in Alabama,
they could have driven to Florida.
Now they can't go to Florida. So Yeah, I think that was kind of the point there. All right, onward. Okay, so you found this story in the Wall Street Journal.
You're living this.
Well, no, I'm not living this, but I'm living a version of this that's far better than what this story talks about. So the headline is millions of American kids are caregivers now. And then in quotes, the hardest part is that I'm only 17. So, and then there is this, this picture. The New York, the Wall Street Journal knows how to get it out of you with these pictures, man, on these special interest stories. And it's this kid. It's a kid, taking care of a loved one. And I don't know if that's his, mom or grandmother. But it doesn't even matter. It's a teenager taking care of a relative, right?
Yeah.
And this whole caregiving thing, which I'm not going to let go because I'm living it every single day.
Right.
And the reason why I said, no, this story is not about me is because I'm 48 years old with resources and connections, living in Nashville, a healthcare city.
Yeah.
Don't spend any time writing a story about me. There's no boo-hoo here. All that's happening with me is I'm getting to live this experience, so I'm being awakened to what so many people who have not yet lived it are going to experience when it comes to caregiving for aging loved ones.
One of your sons or one of my sons having to come home from school and then take care of their mom, and that's their job. And they're not ready. It's going to mean that they don't do things they should do when they're 17.
That's right.
And this is just the beginning of it, right? The boomers haven't fully come in yet. So we don't have the caregiving resources, and especially in lower income, they can't afford home health. They don't have the contacts to call someone and get it fixed. And so they just make do because, he loves his mom. But I don't know that that's right in America. Like, we should do better than that.
Yeah, I'm just looking into the story. So the young man's name is Leo Remus, and he's taking care of his disabled mom. She is she's in a wheelchair here. I think what I would say, first of all, we're going to put the link to the story in the show notes. Please go check out this story. I have tons of resources, tons of connections. I'm in a great city for this. And, thankfully my parents have their own house and they have resources.
Yeah,
okay.
right.
So all those things are true. Our family is about 100 days into this journey now. We're at about 100 days now, maybe a little more than 100 days. We've actually put some great things in place for my parents in their home so they can stay.
In the last 2 weeks.
In the last 2 weeks, yes.
Yeah.
The last 2 weeks have been unbelievable, okay? I still, every day, will have 10 new tasks virtually. Like, we're talking phone, text, email, blah, blah, blah.
We were
calls.
in a meeting earlier and you got a text or a call and had to go.
It's a call, yeah. Every day when I wake up, there's 10 or more tasks that will fall in my lap before I go to sleep that I don't know about when I wake up.
Yeah.
That's every single day. And that's me with resources and a team and all this stuff, dude. I cannot imagine being a teenager and doing this. Okay? Like, it's not fair.
No. I mean, it's not fair to him. It's not fair that his mom's in this situation. It's just not, like, this is in the United States. This isn't like some other country. Like,
and look, I think we need to be intellectually honest. We just got done talking about being fiscal conservatives, being free market capitalists. Some of this has to do with America being so hyper capitalist that we don't have communities that pitch in and support anymore.
Yeah.
Another thing that I've had over the last 30 days is, my sisters came down and spent, more than 2 weeks. My sister left on Wednesday. Guess what? My cousin showed up today with my aunt, and they're going to be here over the weekend, right? So I've also got this community of family that's like all dropping what they're doing and coming here to help.
Yeah,
right?
and that used to be the normal, like the extended family was within a 30-minute drive.
Yeah.
And now we've all moved all over the place. And so
Right.
they're flying in or they're moving around, which you can do, but not every family can do.
And what kind of network, from a social capital perspective, does a teenager have?
None.
None.
I mean, even if he has, say, 20 friends, they don't have any ability to help.
Dude. No, you don't have a network of people with social capital at 17. You don't. So if you don't have a community, or if you don't have neighbors, or you don't have family that can actually help you, you are doing this by yourself. Okay? Yeah. You're doing this by yourself. I can't imagine, and I'm thankful that you found this story, and I'm going to spend some more time, digging into it and reading it and getting a better understanding of it, because this is something that's happening in our community, and I don't think I've ever seen a nonprofit in our community dedicated to this. So I think that's one of the things I want to go see is there a nonprofit dedicated to helping teenagers take care of their aging loved ones?
Or teenagers, but adults too. Like, I think it's caregiving.
Dude, it's a different level of burden. I'm not saying it's not bad for adults.
Yeah,
but man, a 17-year-old. Think about Charlie.
Yeah, he couldn't. There's no way he can do this.
Dude, that would be.
He has enough trouble like getting up and feeding himself.
That would
not
just
be able to do it.
No, it's just not. It wouldn't be fair.
Yeah,
it wouldn't be fair, right?
Yeah, I think it's terrible for teenagers. I think there's a socioeconomic thing. Like the less money you have, the harder it is to care for your family, loved ones.
Yeah.
So like the nonprofit, maybe it's teenagers, but it may just be lower income too that really needs help.
All right, moving on. Walmart is closing health centers, telehealth unit as costs rise. So, Walmart is going to do what they need to do in order to, maintain business performance for sure. But gosh, was it Health Further 2017 or 18?
I think it was 17. But
No. It was 18. It was 18 because it was the one that HCA sponsored. Okay. Where I had Milton Johnson and Marcus Osborne. Yeah. So for listeners who don't know, obviously this podcast is called Health Further, but you may not know we used to throw a conference called Health Further back in before the 2020s. And in 2018 when we threw it, we had a guy who was a superstar. I saw him at a Vibe this year.
Oh, did you?
Well, okay, yeah. For running all things health and wellness innovation at Walmart. His name is Marcus Osborne. If you're in the space, you probably know who Marcus is. And so anyway, I got to interview him on stage, and he was, it was amazing because he was just like, slaughtering all the sacred cows from the stage, and
that was probably the beginning of this Walmart health adventure. That might have been like the first year they started.
Yeah, it was 2018. Yeah. And they started kind of building out all these things, and now this decision affects all 51 centers that had opened in 5 states. So the experiment is over.
Yes.
And they're going to keep their pharmacies and their vision centers. Why? Because that's what grocery stores do. Yeah. That's fine, But they're done with the full. Basically, they're getting out of the healthcare business.
Yeah,
they're getting out of the healthcare business. And I learned about this story actually on LinkedIn because my friend Edmondo Robinson, former chief digital officer at Moffitt, and now off founding some really cool stuff. He posted about it, and he was just basically talking about how, these outsiders really need to look at how they can partner with incumbents, like straight up. So I asked him 3 questions. I said, so I have 3 questions about your statement. The first one is, when you say they should, partner with incumbents, are you saying that hiring doctors, clinicians and admins or admins is insufficient, right? 2, are you saying that they can't actually compete when they get into the space? Or 3, is it that when they get into the space, they realize, oh, this business is just not as good as the business that I'm already in, and I'm just out. Like they don't know that until they get in it, and on the way in they think, oh, this is going to be easy. These healthcare people don't know what the hell they're doing, and then they get in and they're like, oh, actually, this is a really hard business compared to my business.
Stuck in a quagmire.
And like I'm getting all the way out because fair point to him. He kind of pointed out, we've seen it with Haven, we've seen it with Apple, now we're seeing it with Walmart. I mean,
Google, Amazon, everyone has tried it.
You can't do too many of these.
It's $4 trillion a year. I mean, it's always
you got to go after it.
Yeah, it's always tempting.
Yeah, but you can't do too many of these before you actually got to say, probably need to consider getting out of it, right? Entirely, like, and not going back to it, like learn my lesson. And he basically said, yes, you know, it's insufficient to just hire, you know, docs and admins, which I thought was really pretty interesting, right? Because you would think, okay, well, why is that? Why can't you just go hire the same people that are running these other businesses? And I think the fundamental point he's making is Walmart does not exist to operate a healthcare business. The reason they're getting into it is largely economic. And if the reason is economic, then as costs rise, you'll get out, right? Healthcare businesses, they're in it for healthcare. Like, that's what they're in it for. And then they're going to optimize and do the best they can from a performance perspective, but they're not comparing it with some other non-healthcare business line. They're just trying to do the best they can inside of the confines of healthcare. You know what I mean?
Yeah. Yeah. Well, I mean, I guess if you're coming into healthcare because you think it's going to be easy money and, you know, kind of simple, then Walmart should never have gotten in, and I'm not surprised they got out. I think that there's a.
Do you remember what Marcus said from the stage? Because I do.
I don't know it word for word. So what? But it was very ambitious vision.
Well, the main thing that he pointed out, which is what I think a lot of these organizations look at and what drives them to do it, is they look at how much healthcare costs make up their own OpEx. Yeah. And then they layer on top of that how many people walk through their doors, right? And they take those two things and they just sort of think,
we can make this better.
We can do better on the OpEx side and on the top line revenue side. That was what he said.
Yeah. And I disagree with your friend. I think that they are trying to disrupt and redesign the healthcare system. And to date, they have all failed. Like 100% have not been successful.
I don't think you're disagreeing with them unless you have something else you're going to say.
Well, I think eventually, someone will break through.
Well, they have to have the will to.
But they have to have the will
to stick through this.
Yeah,
like Walmart could have hung in there and just eaten it, you know, taking it on the chin for the quarter. They weren't willing to do that.
Right.
I think that's the point he and others who continue to point this out keep making, right? And so far, these industries and these companies are proving the doubters right.
Yeah.
Because they're not willing to stick in there.
Yeah, I think that's right. So, I mean, I think Walmart is probably a good example. They took 5 years and whatever it was, several $1 billion invested to try to do basically an advanced primary care practice on top of next to their stores. Mm-hmm. And after 5 years, they were not successful. And they don't have the stomach or the willingness to take another 5 years and more billions of dollars.
Right.
But I think that Amazon has tried maybe 4 times. They're trying it again in the prescription delivery, where in LA and New York, they're doing 2-hour same-day delivery. And they're going to roll out a bunch of states. So like now they're taking a pharmacy prescription tact. And I think they will take 2, they cycle faster than Walmart. I think they'll take 2 years and run hard at it and learn. And if they find an opening, they'll keep going. If not, they'll just like gear back, figure out what they learned, and then try another angle.
Right.
Eventually, someone's going to figure out a combination that works. But so far, no one has. It's hard.
Again, to me, I'm not sure it's so much about they're going to find something that works as it is about they're comparing businesses. You know, they've got this one business, decades old. They know how it works. It's made them a Fortune 10 company, you know, and then they get into this healthcare thing and their evaluation of how it should perform, you know, they start realizing there's all these factors that actually influence it. Like we were talking about the policy thing earlier, right? Hold on, what the hell do you mean like policy, you know, there's a political fight and somebody decides they want to pass some rule and now my margin is this? Right. And now I got hold on, I have to pay this person this because this person said so?
Right.
You know, I think it's more that. I think they start realizing, holy shit, that like being in healthcare means you're way more under the thumb of the government.
Yeah.
You know, you're way more dealing with labor issues in a way that where, you might be able to swap out, associates at Walmart. You can't swap out docs.
Yeah.
That ain't that easy. So it's just a harder thing.
It might be the most regulated industry where you can also start a for-profit business. Right? Like
where you can do it, where you can actually do it.
You can do a for-profit business.
You can't just start an airline like that. Yeah.
You can't start an airline. You can't start a political party and be a for-profit. Education, you maybe can do, but there's not a lot of for-profit education. And so I think a lot of people look at it and say, well, it's so inefficient. And I mean, we've all seen that price curve where like everything is going down in price except for healthcare and education.
Right.
So we can go in, but the regulation and the complexity and the humans that have, human healthcare needs is a lot of work and hard.
Yep, absolutely. All right. Okay, this is back to CVS. I thought this story was pretty cool. So CVS is basically getting in the business of making copycat biologics, and to me, this just looks like Kroger doing the Simple Truth brand. I mean, it's basically they're getting fully vertical, and they're
CVS does their brand of. They have a house brand of water and chips and whatever.
It's just vertical. Yeah, it's just vertical. Yeah. So it makes sense. Having I think there's a couple of things to this. One. The drug supply chain is a little wonky. And so I think there is an opportunity for, these different corner store drugstores to provide better customer service and more predictability by controlling the full supply chain and controlling their own biologics as opposed to depending on third parties.
In the private label space where it's pretty well established science of how you make it.
Yeah, exactly. And then they can position it better. They can push it. They can, make sure their pharmacists say, hey, did you know that, you can tell your doctor about blah, 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 and we have this, and maybe you save X amount of dollars or whatever, So there's certainly going to be some yield opportunities there. And I think it's likely we see more of this, more white labeling and more branding of these kind of copycats across the board.
I think so too. And I'm going to give Cuban credit. I think they don't do this without Cuban starting his drug platform.
Yeah, I think that's right. I think that's right. I think and look, Cuban is not done. I mean, Cost Plus Drugs was the beginning, but I heard that podcast, with Lex Friedman that he did. Yeah. And I think he's got a full agenda on the healthcare industry of stuff he's going to go tackle.
Great.
It's good. It's good. It's good. He's good for the space, and he's viable, and he's got the capital and the platform and the brand to actually like get it done and instigate and do things.
And unlike a publicly traded company like Walmart, he can sustain losses. I mean, if he decides he wants to do it personally, he's going to do it.
That's right. That's right. All right, and then Walgreens.
Walgreens also has a thing this week. They bought 300-ish specialty pharmacy groups with cell and gene therapy across the country.
I think it's really smart.
This is a better move. They're both are good, but this is much better, higher margins.
Walgreens needed a better move. So I think this is really smart. High margins, limited access from a supply chain perspective, and it just kind of stabilizes what felt like a free fall for this brand. I mean, look, Walgreens is my personal pharmacy for our family.
Yeah, me too.
And it's they've got great locations in Nashville, so that's part of why they are our pharmacy
everywhere. So, I mean, that's their thing.
Yeah, but I hate to hear like the constant stories about what's happening at corporate, the challenges, all that kind of stuff. So I enjoyed seeing this headline, and I hope they figure out a way to turn it around and offer more things, get back on the offensive, because they've been reeling for a little bit. Their clinic stuff kind of backfired. Right. Not sure how the Village MD thing is actually going, but specialty pharmacy
they should be able to do that and make a decent amount of money doing it.
Yep. Agree. Okay, a couple of health system earnings results. We'll move through these pretty quickly. HCA just sort of nailed all their
HCA crushed it. I mean, they're doing really well. The volumes are really high, and the patients are high acuity.
Yep.
So.
Yep. And Tenet also following suit. Yep. Yep. Same situation.
Did well. They both beat. Both stocks did well.
Yeah. I mean, they really have turned into the two big juggernauts in the for-profit space, haven't they?
Yeah.
I mean, just HCA and Tenet kind of neck and neck, with the quality of the results, the size of the platforms that they have.
I think they're by far the best properties, the best management teams, the best platforms.
Really, really
What's
strong.
interesting is it used to be that the payers were kind of inversely correlated from the health systems, right? Where like if one group was doing well, the other one wouldn't do well, and they're kind of both doing well now.
Well, in the case of these, they just have such really strong relationships with their payers, which is part of why they do so well, right?
I think it is probably impacting lesser positioned health systems.
Yes.
They're nonprofits, so we don't see it.
Exactly. But when you're in a really good market and you've got really good coverage and you've got really good specialty groups and just really strong networks and great markets, I think that's basically it. Emily brought this up last time we talked. If you are a health system with a really strong network in a really great market, you have a lot of leverage in your negotiations, period. End of story. And so you're not so much divergent from, how the payer performs versus how you perform, right? There can actually be some, rising tide lifts all boats in those situations. Okay.
So a couple longevity stories. What were you going to say?
No. You go ahead. Yeah. I mean,
this guy's jumping around.
He's jumping around. Yeah. I got to scroll down. I can't look at that.
Yeah.
So Wall Street Journal has this guy. He's a Harvard geneticist. His name is David Sinclair. I've seen him, around a couple times, probably on Twitter. They've got this really kind of freaky bouncing around. That kind of feels like a hit piece when they do that. They have a weird photo of somebody moving around, looking kind of synthetic. But anyway, this guy basically says he's cooking up a cocktail that treats aging as a disease, right?
Yeah, and he is using that cocktail himself.
Yeah,
but he also is selling it for your dog.
Oh, okay.
And as part of that deal is you have to, I think, collect data for him as part of the thing with your dog.
Got it.
And so, I don't know. I think it's interesting. And we had 3 stories about longevity. So. Anyway, this is David Sinclair from Harvard.
Okay. Second one is around scientists uncovering a powerful link between dietary choices and brain health. So the reason why you asked if we should cover it, the reason why I wanted to is because I recently signed up with this group called Wild Health, and they ran a whole bunch of genetic stuff on me, and they came up with links to.
I think Kentucky.
Maybe.
I think I know Wild Health.
Health? Okay. Well,
anyway.
It's like telehealth, but it came out of CrossFit, actually.
Okay.
They run your genes, and then they give you this, it's actually really great. They give you this whole sort of health story with every single SNP. And they kind of go through each one, and they're like, hey, this one maps to, this particular disease, and it tells you sort of how it's currently rated. And so they have this connection between.
They give you nutrition advice.
I mean, they basically tell you do you have any allergies to celiac? Are you lactose intolerant? Blah, blah, blah. All of that's actually encoded in your genes. We now have enough information to see that. So one of the things that I learned in that conversation was, some of the advanced findings from a nutrition perspective as they relate to brain health and neuro diseases, and especially things like Alzheimer's and dementia. And one of the things that the doc was sharing with me was early indications that creatine, for example, is really, really good for long-term brain health, which I hadn't heard before. It used to be they said, hey, take your creatine an hour before or an hour after a workout for muscle development. But they're now starting to find all these other things that creatine is really, really good for. And they're learning that it has nothing to do with not nothing to do, but it's not as much about taking it right before or right after a workout. It's about a saturation level. So he was like, no, you can take it every day. Just take it every day and get your body.
Just make sure you have enough of it.
Just up your baseline of it. It's like creatine.
Kind of a lot of vitamins like that.
Yeah, magnesium, zinc. These are all things you just want saturation and absorption.
If you have too much, it's not you process it, it's fine, but you need to have enough.
Right.
Yeah.
And it's just the connection between gut health, brain health, and what you put into your body, how it actually is affecting your brain. And not much more I want to say than that, other than this is an area people need to, look, if you're like me and you're just constantly trying to be sovereign over your own health and you're hacking your own stuff, hacking has a bad connotation, but you're constantly trying to learn in this space. Look into brain health and nutrition, for sure. There's a lot of information that is emerging
brain health,
around
nutrition, and gut health. There's a good Netflix documentary right now about gut health. I can't think of the name, and then we're going to have Lauren Driscoll next week.
Oh, good.
I recorded it a couple weeks ago, but she'll be on talking about NourishRx and her nutrition. Yeah,
and then sleep, right? Which is another huge one, actually, for brain health. Like you need good sleep. Yeah. But I learned this from my Oura Ring a long time ago. What you eat and when you eat impacts your sleep. Basically, like
you need to give yourself a time after dinner before you're going to go to sleep.
Oh, and I need to ask my friend Stan Frencher this, what he thinks about this. But the doc actually told me that for guys with a potential risk of prostate cancer, how close you eat to bedtime actually has an impact on that. So I need to fact check that with a couple of other people, but I thought that was an interesting thing. I was like, well, that's interesting. So anyway, we're really saying here is A, we're going to talk more about longevity, and B, these are just areas to look into, right? It's longevity is an emerging space. It doesn't fit into the sort of standard canon of healthcare, and a lot of physicians, and I'm friends with a lot of physicians, feel like a lot of this stuff is kind of, kooky and or out there. And at the same time, they are admitting there's something to it, right? They'll say both, yes and, right? So, it's just a space I'm certainly interested in. And
I'm looking at a sleep investment right now. So that's how I came across this.
Oh, cool. All right, into our AI review. So GitHub Copilot Workspace. This is on the Microsoft side of things.
Yeah, so GitHub, for people that don't know coding that well, it is a sharing repository. Millions of people, a lot of people are on there. Big community. Microsoft bought it maybe 5 years ago. And they have Copilot, which is AI coding assistant, sort of like a pair programmer. Like the human is working and then the AI is working as well. And then they just launched Workspace, which takes that technology but puts it in a UI where you can easily complete projects just with the human providing English. So I want to write a front-end user interface in React, and I want it to have these buttons, and you just type in kind of like a normal prompt, and then it does the functional spec, like it makes sure that you're saying what it's going to actually build clearly. Then it does the libraries review, and like we could use this library and this library and this library, and then it actually will say, here are the components we should write, and then it will write it all. You can test it in in the interface so you can see it run, and it's designed for GitHub. Our listeners might not all know, but GitHub is sort of an open source community. So if there's a bug in a program, it will get highlighted, and the community then tries to fix those things, and you may be able to explain it better. But
that's one feature of it. It's basically an online place where people write software collaboratively, and so it's for everyone contributing to code together, as well as fixing code together, as well as discussing code together. So it's all those things. It's like a place where you code collaboratively, you fix code, and you also discuss code.
Yeah. So they launched this in the issue resolution aspect of the open source community. So you can grab an issue, and Workspace AI takes all of the other code repositories and all of the notes from the whole thing and then fixes it.
So Vic, why do you think this is noteworthy?
I think it's noteworthy because it is the second time where it's been AI has been embedded into an IDE, which is a development environment where you can actually build stuff in a way that, a tech-savvy-ish person like me that can't code understands it. And I signed up for the wait list. I'm not in right now. It's a very slow roll. But it looks like you could actually... so the NVIDIA CEO made headlines by saying that English is the next coding language.
Yep.
Which is a cool meme, but it's not real. Like I'm on a bunch of AI tools, and
it's not real yet.
It will. Any of the tools I use will spit out the code I need for a Redact front end, but I can't run that code because I don't have an IDE to do it. I don't know how to compile it. I don't have all the libraries set up. I don't have my environment. I don't have an environment.
Right.
And so what I think is interesting about this is they're starting to build out that infrastructure. Like the core AI was exciting last year, but now Microsoft's building out like the rest of the tool set that I think could be really important.
Okay.
I mean, you're a developer, or you used to be a developer, so you may have a different view.
No. I want to build on what you just said. Okay. So first of all, your reason for thinking this is important is 100% valid. There's nothing I can say to say that that's not valid. I agree, and I happen to agree with it. Mm-hmm. I think that's a very good reason to think this is important. Let me build on that a little bit. I think the fact that it has you excited about that says one thing, and then there's a second thing that I want to point to. Okay. So the fact that it gets you excited is important because you're a non-coder.
Right.
And it's getting closer to enabling people who don't have a specific skill set to perform a skill and fill all of those gaps just by way of their ability to articulate what it is they're trying to get done. And that's what Jensen Huang from
that's
NVIDIA,
that's what his vision is.
That's what he's saying, right? And it's, whether or not it's there or not, once you actually get off the wait list and you test it, the notion of it has you excited.
Yeah,
right?
That's right.
Okay. So that's one thing. I think the second thing is we're going to cover AI on this show every week. I think people will say, well, you talk about AI too much. I think the reason why we're doing it and why we're going to keep doing it is because I want a record of us tracking the progress.
Right.
To the point where we actually get to AI that's valuable, AGI, artificial general intelligence, and then ASI, artificial superintelligence, right? I want to have a record of us talking about it and tracking this process. And the reason for that is when we look at GitHub, what we are seeing is the coding space. And of course, this is going to be the environment where they will best figure out how to integrate large language models into a workflow that's actually viable. Like the problem today is we have these general purpose LLMs and no one can figure out what the hell to do with them, right? They're not put into a context with very specific guardrails designed around user experiences that are for specific people, specific groups of people. But we do in the coding space, right? In the coding space, they're actually leveraging AI every single day. Coders are using AI today every single day.
The studies I see, Copilot makes an average developer something like 3 times more productive.
Developers are using AI every day, right? Even if you in the general public, we in the general public,
are not.
We feel like, the stupid ChatGPT, it kicked out this thing. It's like, I'm not going to use it. The developers are using it every day, y'all.
Right.
Okay.
Right.
They're using it every day.
And they're 3 to 4 times more productive, each of them.
Correct. And so tracking what's happening in the developer space gives us a view into what might happen in the doctor space, what might happen in the medical billing space, what might happen in the VC space, right?
Yeah.
Like we should take some time and reverse engineer what's happening inside of GitHub Copilot Workspace. What did they actually do here? What human process did they replace? How did they replace it? What is the UI? Where did they inject the AI specifically? You know, because you might be able to think about a medical workflow and think about, right here, this would be the place where you would put a specific medical LLM in. You know what I mean?
Yeah. Right. So what does IDE stand for?
Integrated Development Environment.
Okay. So that is an acronym. I think almost every developer uses some kind of environment where they're coding all day.
Right.
And I think Microsoft took the existing, I show up in the morning, get my Starbucks and start working, the existing UI.
Yeah.
And they integrated AI tools to make the kind of the monotonous hassle aspects of coding automated. And we could do that in healthcare. We could find parts where the existing
Can I tell you what the
workflow-
difference is?
Yeah.
Well, the place where that's likely to happen is Epic.
Right.
The place where that is most likely to happen is
yeah, right.
Well, not just EHR, Epic as an organization, and I'll explain why. The reason why GitHub is the logical place for this is because GitHub is the place, the company, the organization, the team that has obsessed about how developers work. They have obsessed about it. Everyone else made IDEs. GitHub went so much deeper into the psychology of how teams, whether they be official teams like a company or open source consortiums
Just
that sort of
passion
come to
projects.
projects. Yeah. How do developers and the other associated people that work with developers, quality assurance, user interface designers, blah, blah, blah. How do these people actually work and collaborate? And they've been building tools for that for, well over 10 years now. So that's of course the right place because these are people who have obsessed about that. And I would say the problem in the medical space is you don't have a lot of people that have obsessed about how doctors work. It's been the opposite. It's more like, hey, you stupid doctor, use this tool.
Yeah. Well, and unfortunately with the EHR rollout, we financially incentivized health systems to put it in.
Right.
Which was good and bad. It drove adoption, but it also didn't really drive utilization in a way that was natural and organic. It was sort of, well, we have to hit meaningful use threshold, so let's force people to do it.
Right.
And so you have this weird, we have digitized everything, but it isn't been fully integrated into the workflow. And I think you're right. Not many people have thought that through, and Epic has thought through the most.
More than anyone else. I mean, whatever you want to say about them, there's a reason why they have the most adoption
I'm
today.
hopeful that Oracle can get their act together.
That'd be cool to have.
They have Cerner, and they have. I mean, they don't have as much market share, but they have 25%, or they have a decent share, 30%.
I don't know that it's for sure across all Ascension, but Cerner is what they use at St. Thomas.
Yeah.
So maybe they have Ascension, and that's pretty big.
Yeah.
That's pretty big. All right, continuing on the AI stuff. So quick hits here. Both Amazon and Meta have both publicly come out after, cutting all sorts of jobs last year, both of these companies, and they basically said, hey, we're going to invest in AI. So they're back on the investing in the R&D stuff. Meta's stock temporarily dropped. I think it's back up now. I think most people were really worried that Meta was going back down their whole metaverse, Oculus, Quest, path in terms of we're going to build out this R&D. What was it, Horizon Labs? We're going to build out this whole metaverse thing and spend billions of dollars on it. And the truth is AI and the metaverse are not equivalents.
Right.
These are not equivalents. Meta needs to invest in AI. AI can have a material impact on their core business. Unlike some goggles, AI can actually make their ad engine significantly more efficient and effective.
Yeah.
Right. They need to invest in AI.
Have you played with it on WhatsApp? I mean, they have 40 AIs in there that will chat with you. It's crazy.
I haven't because I don't trust the Meta company, I just don't. I mean, I use WhatsApp, but I'm not gonna engage with their AI.
I just did it for fun to test it out, and it's I
just have an issue with it.
I think they're sort of really kind of they're open sourcing it, and it's really good. So it's going to drive the business model progression pretty quickly, I think. But their goal is not to make money on the AI. It's just to keep you in their walled garden looking at pictures and their ads and all this stuff. That's their game. It'll be good at that.
That's one of my problems with them. I have a history with them, and whatever. All right, let's keep moving. So Google has continued to step up. I feel like every week we're going to talk about which company released a new LLM that is now beating other companies.
Leapfrogging each other.
Yeah, on the benchmark. So this week it's Google, and they have released a new medical specific AI model called Med Gemini. So they're moving in the direction of branding all their stuff Gemini. And it surpasses GPT-4. So I think 2 shows ago, you and I went through the Hugging Face leaderboard, and we were talking about how GPT-4 was the top LLM in the medical space. Right. So we go back to the friggin' Hugging Space thing.
2 weeks ago, GPT-4 was the best, I think.
Yes, and now Google's LLM, which is Gemini, is ahead of GPT-4, and that's just the pace that we're at.
They were third. We can't show it, but they were third. One of the llama derivatives was also up there.
Yeah, so that's the point. You know, and last week Meta was the one to release their stuff. Every week, another one of them is going to release another one. That is the pace of this race, y'all. That is the pace of this race. It is moving. And it's
diminishing
quickly.
Returns, right? Like the models are very good now.
Yeah.
And
now I'm 2% better.
Yeah. What we need next is integration into our workflow, how we work. That's why I was excited about the GitHub one.
Right.
They'll keep getting better, but they're already good enough.
Okay. Last story in this marathon comeback show for us. Kaiser in the AI space. Talk about it.
Yeah. So they are partnering with a company called Innovasur. Did I say that right? Innovasur.
I think it's Innovasur.
Innovasur.
Yeah.
To roll out AI across their systems in the state of Washington. And so this is a huge AI company in India and San Francisco. Mm-hmm. And Kaiser has already invested in them. It's interesting because it's a big health system picking a new partner that is not in the top 5. And so that's pretty interesting. They are looking at replacing their electronic health record with this so that they are able to interact with any health record wherever it is through this tool. That's what they're talking about.
Man,
how easy that is to do or possible, I don't know, but that would be great if we could do that.
Dude, I think we got to spend more time looking at Kaiser, man. I mean,
Kaiser's great.
They are operating like on a different level. You know, like they're in sort of West Coast California, a little bit in Colorado, so we don't get to talk about them very much now. Obviously, they've formed Ryzen with Geisinger.
Right.
They're going to keep the Kaiser brand, obviously, but just the way they operate, it's so different.
So different than the Nashville,
it's so different, man.
Crowd.
Yeah, and I mean, they come across to me as very capable, right? I mean, have you been to Kaiser headquarters?
I have not been to headquarters.
Okay, we need to put that on our list of things to do. We need to make some connections at Kaiser.
I know the VC crowd. I can talk to the VCs there.
Okay, well,
we can start there.
Let's start there, man.
They have a good corporate VC, but they are. It's a different model than the for-profits because they're nonprofit, but they're a payvider.
They're a payvider,
right? So they have the whole thing.
Yeah,
you're in the you're kind of in the Kaiser Permanente world.
All right, man. Hour and 30 minutes later. We finished the show. But anyway, look, lots of good stuff to cover. Great job putting the show together. Looking forward to you releasing the show next week with Lauren Driscoll from Nourish RX.
And we had our first in the series of heart health.
Came out
this week.
Yeah, Dr. Sinu Reddy. Yeah, that was fantastic. Great. Good job on that. And then, as always, we will be back next week with another roundup of the news.
Yeah.
All right, until next time. Bye.